The 24-year-old athlete made his NFL debut in 2021. On the night of January 2nd, 2023, Damar Hamlin made what looked like a routine tackle. Hamlin stood up immediately after the tackle, but loses consciousness and drops to the ground, lifeless. Now, let's examine the timeline of events that occurred. At 8:55 p.m. Eastern Standard Time, Hamlin collided with Bengals receiver T. Higgins, then collapsed shortly after. According to CNN, within about 10 seconds of the collapse, trainers and physicians were treating him. Now, I'd say this is controversial because tending to and treating is very different. I don't believe that within 10 seconds, you'd be able to treat someone that collapsed when you have absolutely no idea what had happened. Remember, this is a completely unprecedented situation. Medical professionals rushed the field to tend to Hamlin. They administered CPR for about 10 minutes and administered an automated external defibrillator. It's documented that by 9:14 p.m., his heartbeat has been restored while he was on the field. But we really don't know exactly what time between 8:55 and 9:14 his heartbeat had been restored. And this is going to be extremely important. At 9:25 p.m., Hamlin was given oxygen and was transported to the University of Cincinnati Medical Center by ambulance. At 1:48 in the morning, the hospital confirmed that Hamlin had indeed suffered cardiac arrest. And as of filming this, at about 10 p.m. Eastern Time on January 3rd of 2023, Hamlin is still in critical condition. So what exactly is cardiac arrest? This is a medical condition that occurs when the heart suddenly stops beating. Now, there are several doctors that believe he experienced commotio cordis.
In that tackle, the opponent's helmet was in his chest, so he had blunt force trauma to the chest. And in the exact right spot, at the exact right moment during his heartbeat, it caused his heart to have what we call an arrhythmia, not beat effectively to push blood to the brain. So he stood up, not enough blood went to the brain, he fell down, and that heart was in ventricular fibrillation. What we know with this commotio cordis, which is this condition, is that every minute you delay shocking them, resuscitating them, what happens is there's an increase of 10% in mortality. They started CPR right away, which is great. My hope is they were able to restore the heart rate soon enough to be able to get blood flow to the brain so there's no damage there.
It looks as if what happened to Hamlin was that he suffered an arrhythmia, so his heart stopped beating. And the question becomes, well, then what caused it? And it seems as if in this case, what probably happened is that he suffered commotio cordis.
Stood up and then went down. What are you able to tell from that little bit of video?
Certainly, David. Well, what we can tell is that the event was most probably secondary to that hit. There are other episodes where athletes are running, they're exerting themselves, and will have a ventricular arrhythmia secondary to a hypertrophic or enlarged heart. That's different. This was traumatic. And we see that hit happened in that upper chest area. And there are a couple of things that could happen under this scenario. The first we think about, obviously, is the spinal cord injury. It doesn't seem like that's what happened here. Because when you have a spinal cord injury that does injure acutely that cervical spine, you don't get back up. You're on the floor and you'll stay on the floor. He was able to get back up. That leads us to believe this was more of a cardiac injury. When you have a cardiac injury, a couple of things again could happen. With a large enough hit to the anterior chest, you can transect the aorta, the large blood vessel coming out of that heart. But when that happens, number one, that's not survivable usually, and you don't stand up after that kind of injury. Even if it was a mild dissection, these are very significant injuries. It's a very common injury. The third thing we're thinking about, it's called the R on T phenomenon. This is a phenomenon that when the heart is going between its beats, as that heart is depolarizing and then repolarizing, if you have traumatic trauma to the chest, at a very specific moment, as that heart is repolarizing itself, you can go into a lethal ventricular arrhythmia. And that's what it looks like it happened because he was able to stand up, and at that point, his heart started what we call defibrillating. That's that cardiac arrest. That's when he collapsed back down, and they would have recognized at that point no pulse. If it had been a cervical injury, you wouldn't expect him to have lost his pulse that soon. Same thing with a transection of the aorta. You may still have a pulse for a very brief moment. At this time, he had no pulse when he hit the ground. That's more of a ventricular arrhythmia that he was having. This is a dysrhythmia that happens after trauma. We know that we have AEDs, or the automated defibrillators, all around our community. I am certain that they were in that facility. They were also on the ambulance, and we hope that he was defibrillated quickly. And that brings the heart back relatively quickly because it shocks that dysrhythmia back into a normal heartbeat. They would have immediately intubated him and protected his airway, which they did. And if they're able to bring that heart back by defibrillating him at this juncture, whether he survives or not, it will be dependent upon how long he was down and how long he was not getting oxygen. And now it sounds like he is in the ICU or in the medical facility, intubated at this time with a heartbeat. That's the information we're hearing right now. That means that he was most likely brought out of that lethal dysrhythmia, and now it's going to be dependent upon how long he was down and how much anoxia his brain would have sustained. Yeah, so the name of the game here is really that 9 to 10 minutes that he was down and how much injury that brain would have suffered from having the anoxia. We know about 3 minutes is when you start having really significant brain damage. However, he's very young. He's 24. He's a highly conditioned athlete, so he has a lot of reserve. And so it's possible that he will do fine if this is what we're talking. We don't really know the underlying cause yet. It could be a number of things, but the most likely is this arrhythmogenic phenomenon that happens when you have blunt chest trauma as the heart is going through its phases. If that's the case, he would have been shocked, intubated, and now it's a matter of seeing how much damage happened to the brain.
This unfortunate event has really brought us all together, and we pray for Damar Hamlin while we anxiously await updates on his condition.